This episode was the result of a partnership with YouthBridge Community Foundation through its Think Big for Kids grant. This project by St. Louis story stitchers titled Perception Isn't Always Reality will create a public service announcement campaign as trusted messengers about mental health stigmas.
Come stop and take a trip down on my block where you see hidden potential, young minds sharper than Ginsu, and ain't afraid to speak their mind if they got something against you. We standing with you, we tackle issues like civic pride. Hate will cease to exist, let's put our differences aside. From my side to your side, from Dutchtown to South Side, from Penrose to North Side, from Benton Park to Old North, the West End, the West Side. We blessed when we step out, we stand down, rise up, stand together, wise up.
This is StitchCast Studio, produced by St. Louis Story Stitchers in St. Louis, Missouri.
In this week's episode, our StitchCast sits down with Dr. Mati, Director of Health for the City of St. Louis.
They say who that, but you already knew that. That be them story stitches. Story stitches, story stitches, story stitches, story stitches.
Hello, everybody under the sound of my voice. I want to thank you for tuning in to another episode of StitchCast Studio. I'm your host, Brandon Lewis, accompanied by several members of our StitchCast. How you feeling?
Yeah, I'm cool.
Hey, what's up? Now, today we got a very, very special guest. This is, I guess technically, this is our third time sitting down together to have a conversation. We did TV Corner. We did the library. It was the Central Library.
That's right.
And now I heard we finally got you to come to the center and see the space.
I'm offended. I feel for as close as we are, this should have been happened. So
what you mean?
I want to just tap on record that I'm going to be invited back more times for as much as I love and adore y'all.
For sure.
All right.
And I would just like to also add that something changed in between the first time we reached out to you and this time. I didn't realize that, you had got so busy that we couldn't email you directly. So
that's what we doing in front of the people. Got it. That's what we doing.
I'm just saying. I ain't saying you big time. I'm just saying you got a lot on your plate.
So what we gonna do is, if we think that we can do this 5 versus 1, just know I stay ready.
Stay ready.
Listen, you have direct access to me at all times. The amount of love and respect I have from y'all, for y'all, and the way that I've watched you grow, and you guys already were so innovative and so impactful when I first met you, blew me away, right? But to see what you've built now, for those of you who obviously can't see us, I'm sitting in a space that is so intentional in every single corner of this room. And it is, it's interesting how people like to condescend young people as if adults are the only ones who understand how to lead and run businesses. But what I've experienced today and have seen from y'all over the years exceeds that. So hear me when I say this, you will always have direct access to me. And Mika is just the more organized out of the two of us. So my assistant is always on the CC to make sure you get what you get when I'm not as responsive as I'd like to be. But much respect. I'm so proud of y'all. And I learned from y'all, to be honest. You teach me about how to be impactful. So
Thank you. Ladies and gentlemen, for those that don't know, this is our current Director of Health, Dr. Mati. Thank you so much for being here.
My honor.
Yes, thank you. So let's hop right into it. So we're working on a PSA in which we hope to help destigmatize mental health and needing help for mental health, specifically in the Black community, but we love to make change even bigger than that. That being said, before we get into the stigmas that come with mental health and why it's important to talk about mental health, how did you get your start in medicine? When did you decide that this is what you wanted to do? You don't have a small job. It's not a small job at all. So you have to be committed to do that.
Thank you for acknowledging that. It's not easy.
Absolutely.
So many of you may not know, I'm originally from Zimbabwe in Southern Africa, and I was born and raised there until the age of 18. And then my mom put her oldest and first child on a plane to go to school halfway across the world, which says a lot about her as a parent. This is, in 2001, right, when it was unheard of for a lot of people from where I'm from to even do that, right? But my mom prioritized education, really raised us to believe we can be anything we want to be. I had some unfortunate instances in my life, the death of two very important people to me, my father when I was 15, and then my great aunt, that made it always be medicine. It's interesting because had those two events not happened, I probably wouldn't be a doctor today. I can assure you that my natural talents at the time in high school lend themselves to actually the arts, writing. I love writing. I know I've got a book in me at some point, but not now. We got a lot of work to do in community. Yeah. But when my father died and how he died and our relationship before he died really struck me. There was a lot of guilt, and it was important to me that physicians, doctors, were good people, kind people, took care of him in his last hours. And so it was always going to be medicine. And then I experienced something as a teenager in my country of Zimbabwe. I watched the HIV epidemic just really ravage our country, our communities, and I watched orphans being raised by older people. I saw the age of mortality, the age that we expect people to die, plummet. You expect in a healthy society, people die in their 70s, 80s, right? 60s, 70s, 80s. People were dying in their 40s, 50s, right? As a result. And so on top of wanting to be a doctor, I always wanted to be an infectious diseases doctor because of that personal connection to how HIV impacted my country. But this job right now that I'm in was never part of the plan. And I think that also speaks to the fact that sometimes we have a plan in our head and things change and we move and we grow. So when I became a doctor, I went to medical school and I was going to go back home to Zimbabwe, but you make plans and the universe laughs. And, I met my husband, so I stayed here. And then as I was practicing as a doctor, I realized a couple of things, that I wasn't the kind of doctor that wanted to just be in a clinic every day, all day. I wasn't the kind of doctor that just wanted to do research and be in a lab somewhere. I'm about people. Like you all have experienced that. You know how I am. I love people. I love to make people smile, laugh. I love helping people. I love listening to people. I just love being in community with people, right? And so it's not fake the way that we interact when we're around you. I love this, and my assistant knows my calendar has to have a lot of in-person, in-community type stuff because that's how I feed my innovation in my job as director of health, is staying connected to what's really going on. And so I was always in community as a doctor on my own time, talking to people, teaching people, speaking. And soon enough, community leaders started to notice. And so when there was the opportunity for a new director of health for the city, those same leaders are the ones who encouraged me and advocated on my behalf to the mayor. And the rest is history.
Beautiful, beautiful.
Hey, what's going on, everybody? You already know what time it is. Time for another StitchCast Studio Arts Interlude. That's right, it's time to pick the city up. This week, we have a Story Stitches original song entitled, Can You Tell?
Tell me, can you tell what's on my mental? It ain't easy to go through all that I done been through. It's hard to talk to ones who left, I used to vent to. Nowhere to go, what am I supposed to get into? Story Stitches, we the ones who not against you. To walk in these shoes, you gon' need some tissues. We tryna heal these scars and we tryna get rich too. Just listen to the story that we tryna stitch you. Look, you not from what I'm from, so you don't understand my issues. My city treacherous, say too much and they come and get you. It's pitiful, everything you've gotta go through. No answers in the hood, so the streets is the go-to. So come to Story Stitches, just like we told you, and put your trust in us so we can build and mold you. A lot on my mind, but not a lot of time. Hard to tell I'm hurting with this smile I'm hiding behind. Traumatized from the past, I wish that I could wanna go back. Don't know how to cope, so I just put it into my grind. I'm trying, but it gets hard to handle when all my peers are dying and we keep Tell me, can you tell what's on my mental? It ain't easy to go through all that I done been through. It's hard to talk to ones who left, I used to vent to. Nowhere to go, what am I supposed to get into? Story Stitches, we the ones who not against you. To walk in these shoes, you gon' need some tissues.
Crying over lost ones, gon' need some tissues. You be mentally scarred from what we lived through. Yeah, what we lived through, can't you tell what I've been through? Reminisce to back when I was just a kid, been complacent with where I live, cause I knew it is what it is. But somehow, when I grew older, I grew colder. Legs sore from running from my past when my mind was racing forward. But now I'm stressed, I'm trying to keep my breath beside me, thinking it's only me, but it's four shadows behind me. I'm racing against the clock, desiring perfect timing, but timing is never perfect. The ticking out of alignment, aligning with all the times I had witnessed my demons trying to chase me. Now I'm facing the fact that my spirit hiding. My ego died and deceased, off to find peace, left me behind with this trauma inside.
Tell me,
it's
can
only
you tell
me,
what's
can't
on my
you tell?
mental? It ain't easy to go through all that I done been through. It's hard to talk to ones who left I used to vent to. Nowhere to go, what am I supposed to get into? Story stitches, we the ones who not against you. To walk in these shoes, you gon' need some tissues. We tryna heal these scars and we tryna get rich too. Just listen to the story that we tryna stitch you. That we tryna stitch you.
Getting into mental health itself, in our culture specifically, it's not exactly prioritized. Quite the opposite. And granted, a lot of generations before us couldn't afford to prioritize mental health, so that's not to talk down on talk down on them. You know, they had like very present, very physical dangers that they had to deal with, and so they couldn't always afford to sit and think about how they felt. That being said, I think unfortunately a side effect of that was the stigmatization of mental health. In your opinion, how do we go about destigmatizing mental health, and more importantly, or just as importantly, how do you measure the effectiveness of destigmatizing mental health?
So let's take it in two parts. Let's talk about destigmatization. I think we have to acknowledge, we have to say it out loud. I'll give you an example. In my language, Shana, there isn't a word for depression. There isn't a word for anxiety. There isn't a word for PTSD. So how do you even advocate for or try to address something that you don't even have language for, right? So then let's take that a step further. Sure, in English we have the words for it, but do we create space for it? Right. Coming up in the schools I went to, in the businesses that I've worked in, even in hospitals, there wasn't real culture around normalizing how we talk about, how we address mental health in a way that did not hurt people. What do I mean by that? The moment you got a label of depressed, clearly you need to be away from here. You need to go home and handle that. That can affect your paycheck, right? The moment someone labels you as having a mental health label, now you're seen as maybe unstable. So that follows you in your career. That affects your ability to get a job, keep a job, get promotions, right? And even if it wasn't true on paper, the fact that we didn't talk about it meant people assumed that was what was going on, right? That's the stigma, that's the fear, right? I don't know how talking about my depression or anxiety is going to impact me in this place where I need a check, where I want to be successful. So past the fact that in some cultures there aren't even words or spaces to talk about these things, there's the perception of what talking about or owning whatever it is you have going on around mental health, behavioral health, how it will impact your life. And then lastly, through the work of health equity and disparities, we know that there is data and documentation that says that harm has been caused by the way people have talked about or owned their mental health or behavioral health challenges. So it's not a fear that isn't rooted in fact. So we also have a lot of work to do to hold people accountable for when they cause harm, because they should not, right? If we do not stigmatize people for having a diabetes diagnosis, if we do not stigmatize people for using insulin or some other form of medication, why should we stigmatize people when it comes to mental health or behavioral health? The answer is we should not. So it's triple-fold. Make sure that we actually have the words and agency to talk about it, right? Make sure that we make it safe for people to do so, and hold people accountable who cause harm, I think, is how we should address destigmatization. I want to acknowledge, for the purpose of this podcast that you heard, I'm not a mental health or behavioral health expert. I'm honored to be the director of health for all things health, and I am very fortunate to have brought people onto my team who are experts. So everything you hear today is through the lens of my experience as your director of health, but I do not claim to be an expert either. So I want to show respect to the experts that I know y'all have access to.
Absolutely appreciate that.
So the second part of the question is, how do we measure it, right? And you've heard me say this before, but data is justice when used correctly on behalf of and for our communities. So I believe that having data sources that are embedded in equity, in health equity, is essential. What do I mean by that? That means we make sure that we are going into community, asking community, what is it that you need? And then we hire epidemiologists, data specialists who care about health equity, who care about mental and behavioral health, to gather that data and use it to build programs, use it to evaluate programs, use it to hold the people like me, whose jobs it is to bring those mental health and behavioral health services accountable. We also need to educate people, right? So education is important, and how we educate. We have to track metrics about how well we're educating people around stigma. That includes building campaigns and things of that nature. One thing I'm doing in the Department of Health around how we measure this is building reports. So it's doing a lot of research into how do the experts say we're supposed to track mental and behavioral health metrics? And there's so many definitions underneath that, right? How do we track those? How do we report those, right? And then what do we use with that? How do we use that data to either build new things or to fix the things that are broken? So to me, that's how we think about tracking. Around that, you just don't need numbers people and data people. We need to build trust within the community. You can't measure or track something if there isn't trust. So you need to bring the trusted leaders to the table. The Department of Health, we built a coalition of over 30 behavioral health specialists that we meet with every month. So we're having conversation about not just the work we're doing, we're asking them, what do you think? How can we be better? What are you doing? And we're working together. And then there are short-term and long-term ways to collect that data. Another example is that every 3 to 5 years, I have to get your health department reaccredited. And so I have to do a community health assessment, a list of very carefully thought through evaluation questions to find out how we're doing, right? And then we use that assessment. We have to build a plan based on that assessment, and an accrediting body measures that. So there are multiple ways that we can use data that is embedded in health equity to make sure that we are measuring these metrics around behavioral health. Does that make sense to you?
Yes.
Yeah.
Yes, perfect sense.
I have a question to, I guess, kind of weigh. How do we accurately kind of find this data for the mental health stigmas and all that? Because people lie. It's just the honest truth. People lie, especially in the Black community when it comes to things like that, because there's this stigma around it. You know what I mean?
Yeah.
So how do we accurately track that data?
That's such a great question, but I mean, there's courses in universities that are, tracked, that you could lecture on that for a year round. So I'm going to give you a very superficial, but the beginnings of what I think is an answer, right? The first way that you track data is to make sure that that data is not just numbers. There's quantitative and there's qualitative data, right? So there's numbers that we can track that help us show a pattern of whether we're doing better, we're staying about the same, or we're doing worse, right? But there's also things that you can't track in numbers, right? That's qualitative. And we can collect that qualitative data, is what people say, their experiences, right? And that should give greater depth to that. There is hiring people whose entire life's work is around either the collection and reporting of data, as well as being mental health specialists, right? There is making sure that that data is collected at multiple levels, right? On an individual basis, a community basis, according to zip codes, regional, states, national, and does it make sense across the ground? And then that you build in systems to fact check the data that you are collecting, right? Especially the numbers there within. That's a very broad answer, but it means really what I'm trying to say to you is that you've got to be strategic about it, and it's got to be with intention. It takes a lot of time to develop those types of systems. So when I took over this job as your health director, there wasn't even one person hired at the Department of Health to do the work of behavioral health. Wow. We were exclusively taking the money we were given for mental health and just subcontracting it out, meaning we would put out request for proposals or like an application for people, just like you guys have applied for grants before, someone would get it and we would just say, please do this work for us. That's a great way to support people in community, but it's not a great way to do business.
Right.
How do I have a priority for mental health that doesn't even belong to me and that I'm at the mercy of how another organization does it, right?
Yeah.
So it took me a year to use a relationship I had with the CDC at the national level for them to give us 7 employees to build a strategic plan for a year, an implementation plan for a year, a data dashboard for a year, and a health equity plan for a year, which bought me time to start hiring people from St. Louis. More than half of the people in the bureau you now have as a result are from North St. Louis. Know what it's like. North St. Louis being, by my data specialist, the place where we have the worst outcomes for mental and behavioral health every year, just like we do for most other health indicators, right? So now we have a bureau that represents it, and I can hire experts and we can do some of the things I'm telling you to. But I also believe it's so important for it to be by us and for us to be accurate, because nobody can tell our stories.
Right.
It sounds like a lot of the obstacles that we face or even come from dealing with mental health deal on a systemic level, whether it's financial and it affects, how you are able to work and receive your finances, whether it's healthcare, that can be kind of a battlefield as well, trying to find the right doctor. If you're able to find one in the first place, if you have insurance that covers that, if you're able to afford it. So there's like a lot of pushback in the area. I was gonna ask is there something that like everyday people that we can do or implement into our lives habitually that can like start to unlearn these kind of stigmas, kind of help promote this mindset to the people around us. Obviously the change won't be super visible right away, but a ripple in a pond.
Yeah. Again, y'all are so deep that you've hit the nail on the head, right? Just what you talked about, there's textbooks about. So without saying it, what you said is, it's not like mental and behavioral health just exists in its own vacuum, and that's the only issue that community has to deal with, right? There are what we call social and structural determinants of health. Whether I can drive to an appointment, whether I can pay my bills, whether I can buy groceries that month, whether I have childcare, right? Whether I have a job that is stable that can pay. So a lot of the times, the real tragedy is that people cannot even prioritize their mental health. If we were to sit down and say to somebody, can you prioritize all the things right now that you think are the most pressing in your life? I promise you mental and behavioral health wouldn't even be top 5 for a lot of families, especially in the communities that we come from, right? They would be talking about I need a check every month. I need my car to be stable so I can get to places. I need food. Do you see what I'm saying? And nobody should have to prioritize those things, right? A thriving society in these United States of America that we call a #1 world superpower should not have like large groups of people making those types of decisions. But that's what we call social and structural determinants of health. It means that at any given time, you can't even focus on your health or by extension, your mental health, because you're worried about all these other things. And those things become barriers to you taking care of your mental and behavioral health. So the reason why health departments exist, the reason why I left my very cushy, well-paying job as a doctor in a hospital to take on this job as your director of health is because that's my life passion, is really making people understand, #1, that the mental health crisis is such a crisis because people can't just focus on their mental health. They have to worry about all these other things. And that our response to mental and behavioral health can also not just be about mental and behavioral health. It has to have an awareness of all those other things. So if you look at our reaccreditation plan, I was telling you we just did that 3 to 5 year assessment and then we built our plan. That's what our plan looks like. It doesn't look like one thing that I write about or a list of things separate from each other. It looks like a cogwheel where everything is interconnected. And we talk about mental and behavioral health in the center, but all these other things feed into it. How people get to where they get to, how people eat, their other health concerns, right? So it's important to do that. So can I give you an answer in these, Brandon's going to tell me to wrap it up in a couple of seconds? Absolutely not, right? But it's like there are so many. That's the whole central part of what public health It's understanding that for any given priority that we have, that people have all these social and structural determinants of health that we need to stabilize so they can focus on that one thing. And in this case, that's their mental health. Great question.
So, with all of that being said, how can we empower individuals to seek help and not be afraid of the repercussions that, the stigmas that might?
I love that question. Exactly what we're doing, right? When I was coming up, there wasn't a podcast of all Black young leaders sitting and talking to the health director about mental health. You are the pioneers, right? This is becoming normal, but you deciding that this is important enough to take to your peers is something that blows my mind. What I'm doing today is the most important thing I've done this month as your health director. Sitting down with all Black leaders in the region talking about mental health blows my mind. So that's number one, is talking about it over and over and over and over again so that it's normal. It's as normal as talking about apples or talking about any other thing in life. You feel me? I don't know why I said apples. My brain was going fast to find something normal, and here I go and say apples. So let's try that again. Talking about food. You know what I mean? I could have said food, Brandon, but your girl said apples, right?
It's cool. We're going to cut it out. We're going to make it look like you just said
and
food.
if this makes it to the final reel, your girl has not eaten today. I was trying, okay? I was fighting for my life to come up with a good example. But it's as common as thinking about food, right? We should talk about it to normalize it. What are some things that have happened nationally that excite me about that? 988. For this whole time, we've had 3 numbers for an emergency, 911, right? Everybody knows that number. My 4-year-old right now knows that if mommy goes down, press this button on my phone, it's gonna call 911, someone will help, right? That is so normal. There is nothing stigmatizing about how we call for help. Don't talk to me about the opposite side. There's a lot of stigma around who comes to help us or should come to help us, child. But, right, there's nothing stigmatizing about that number. So the fact that over the last, how long has 988 been with us now? I want to say close to 2 years, right?
It's mad new.
It's new though, right?
Yeah, it's really
been
new.
about a few months, about a year. So
it's been about a year.
Yeah,
I think I knew about it before it was rolled out, so it feels like 2 years.
The ads started coming out on places like YouTube and stuff maybe 4 months ago.
Yeah, this is new.
Yeah.
So the fact that this is becoming normal, normalizing saying if there's a mental or behavioral health crisis, here's 988 is the other number. 10 years from now, 988 is going to be what 911 is to us now. That's revolutionary. We need more of that. We need to normalize talking about this in our homes, right? We should be able to sit down with our parents, with our siblings, with our friends, and normalize talking about mental and behavioral health. So that's number one. Number two is we should be able to find access, know where to go and find help. You should know, I can quickly log on to the Department of Health. We've got a list of resources about mental and behavioral health, right? If someone's in crisis, someone is having a mental health crisis in front of me, I can quickly call 988. We have to normalize that, right? But I think it's just by starting by conversations, talking about it, and then making sure that anyone in any community at any time knows how to get that help and can easily find it. And that's a challenge, right? Because what do you do if you don't have a working phone, you don't have access to internet, right? We have to make things normal like that. So it's unique partnerships like the ones that I have with the St. Louis City Libraries, right? To make sure they have resources. Where do people go? We know most kids touch a school, hopefully at some, time in their life. We know that that's where they mostly are. So it's making sure that teachers and schools have counselors and the teachers themselves are trained around this topic, right? So that I have a reasonable confidence that any human in the city of St. Louis has at some point heard about this and knows where to find help.
Okay, let's say for a man, right? How can he talk about this around his other friends who are also males and not just females? Because I know not every male is able to present themselves or in an empathetic way when it comes to mental health, like a grown man.
Yeah. Stigma is a complex thing. Stigma is not just about the topic. Stigma is about how we treat people once they have been brave enough to talk their truth, right? So I think we need to role model non-judgmental speaking, right? This is a safe space, and you can just, unless outside of you actually abusing me verbally or physically. I'm going to give you space to at least say what you have to say and ask what you want to ask. There's so much fear right now about discussing certain topics because of fear of judgment or retaliation or how people will see you. And so I'm never going to speak on behalf of a man or a person who identifies as male, because I do not. But I will always say that what I want for my husband, what I want for my male family members is for them to have that, to have safe spaces. One of the programs I'm really proud of that we have at the Department of Health is we have a men's initiative that's, led by Bobby Williams, who's an incredible public health leader, but who also is a veteran of the Army. So he really understands how you can be in an environment where it's not normal to be able to talk about some of these topics, and he builds it into this program. And we hire young people. We have an incredible program through Slate where we bring in young people through paid internships to work in the Department of Health. So we have that presence of young people, older people, or as we established when I got here today, aunties like me, right? I'm in my auntie status right now. And so you want people from every stage of life, because you think about men, but sometimes this is not a comfortable topic for much older people to talk about, especially since they didn't have it coming up, right? So representation matters, and safe spaces for people to talk, making sure they're not judged when they do talk. And it's also okay to make spaces inclusive, meaning anybody, regardless of gender or sexual identity or any other label, can be in. But it's also okay to say we can have spaces where just men are, so that they feel comfortable talking about some of these topics as well. Those are some of my ideas. But what y'all think? Does that make sense?
No, I like it.
Yeah.
I like it.
Yeah.
This special edition of StitchCast Studio is supported in part by YouthBridge Community Foundation through Think Big for Kids. Story Stitch's creative youth development programs are supported in part by the Lewis Prize for Music's 2021 Accelerator Award. The mission of the Lewis Prize is to partner with leaders who create positive change by investing in young people through music. Additional support for StitchCast Studio and Story Stitch's programs is provided by the Regional Arts Commission, the City of St. Louis Office of Violence Prevention, in partnership with the St. Louis Board of Aldermen through the 2024-2025 programs to reduce crime among at-risk youth, and Tegna Foundation. St. Louis Story Stitcher Studio, the center, is supported in part by Kransberg Arts Foundation, where Story Stitchers is a proud resident organization. Thank you for listening.
They say who that, but you already knew that. That be them story stitches, story stitches, story stitches, story stitches, story.